Transcultural Health, Week 3. Culture is shared patterns of communication, similarities in dietary preferences and food preparation, common pattern of clothing, predictable socialization patterns, shared sense of belief, and it is not static, it is constant changing, but ever slow. Basic concepts to know for transcultural health. Culture is defined as ways of thinking and acting developed by a group of people that permit them to interact effectively with their environment and to address concerns among the human condition. Worldview shapes culture. Look at your universe in relationship to that universe. Ethnicity. This is belonging to a common group with shared heritage, often linked by race, nationality, and language. Nationality. One's country of birth can also refer to a country adopted of permanent residence. Race. This is the artificial categorization based on genetic inheritance and such physical characteristics as skin color, blood type, hair color, texture, and eye color or shape. Pluralism involves the presence of multiple distinct entities or groups within a society. These groups may be the result of differences in culture, ethnicity, nationality, religion, or other characteristics. Some differences in terms that you need to make sure that you understand. I think they're pretty self-explanatory, but we'll review them just to be on the safe side. Immigrant. This is a person that comes to live permanently in a foreign country, and this is done by legal means. Refugee is a person who has been forced to leave their country in order to escape war, persecution, or natural disaster. Illegal alien is a person who has entered or resides in a foreign country unlawfully or without the country's authorization. Culture is learned from a person's environment or within the family. Culture learning is most often compared to the way humans speak. Norms are most implied and often unexpressed. Influences are that of the food eaten, how children are raised, how they react to pain, respond to health care, deal with death and dying, setting guidelines for living, provide foundation for client behaviors, support for a person's social development. Biomedical and professional cultures is learned in a context of specific education preparation and through interactions with other professionals. Assessing culture as an individual, they have strong ties to the culture. The nurse needs to be sensitive to the impact of the culture. Behaviors may conflict standards of healthcare that is provided in the community. Each community has its own culture, its own morals and values. They make it distinct, and that influences decision-making. They also demand respect, and that respect becomes authentic when it includes the ethical and cultural context or setting where care is delivered. More terms to be aware of. Emic and etic. Emic is the local or insider's views and values about a phenomenon. For example, someone would be looking at an emic view if a Joplin resident describes the tornado in the aftermath. Etic is the professional or outsider's view or values about a phenomenon. For instance, the CNN reporter describing the tornado aftermath. The difference here is that one experienced it and one observes the aftermath of the experience. You will want to make sure that you understand the differences between emic and etic for the test. Culture and health. Their positive and negative consequences. Direct specific cultural prescribed practices related to diet and food or to health and illness. Indirect is those that are via cultural definitions of health and illness, acceptability of healthcare programs and providers, and cultural influences on compliance with suggested health or illness regimens. Culture factors many times will determine whether or not a person will follow recommendations when they do seek help. Health culture is the system that attempts to explain and treat sickness and to maintain health. Component of the larger culture or tradition. Maybe a popular or folk system or technical or scientific one. Biomedical cultures that characterized by several prominent features including mind-body dualism, conceptualisms of disease versus illness, focus on cure over care, includes rituals primarily based on dominant culture values of efficiency and time consciousness, It changes between risk-taking and risk avoidance, which then are the positive and negative benefits. The U.S. is more ethnically and culturally diverse now than ever before. Currently, the minorities are 1/3 of the U.S. population. It's anticipated by 2042 that minorities will become a majority. So, the challenge to you is to not think of it as a melting pot. I could bet you all of us that were in through school, primary school, elementary school, however you want to classify it, were taught that the U.S. is a melting pot. So I now challenge you to not think of it as a melting pot. Think of it as a tossed salad. There are different ingredients in our tossed salad: cucumbers, onions, cheese, croutons, sunflower seeds, eggs, ham, whatever you put in your salad. And each of those ingredients have a distinct flavor and taste and texture. The U.S. is the same thing. We have many different cultures coming into the tossed salad: Arabic, German, Irish, Hispanic, etc. Then the tossed salad, then they all are put into one bowl to make the tossed salad. That being the U.S. being the salad, the bowl, the that puts it all together. Each has a distinct flavor, taste, texture, but together they are the tossed salad. They make up the country. Nurses must have knowledge of the cultural groups with which they interact and perform a cultural assessment. This is a determination of typical beliefs, values, and behaviors, and assess individual members of the group in terms of their adherence. There are 4 principles that should guide the study of culture. View the culture in the context in which it was developed. Examine the underlying premise of the culture, determine behavior. Examine the meaning of the behavior in the cultural context, and recognize the intercultural variation. Obtain cultural information by recognizing the influence of the culture in its own life. It might be helpful to read literature related to other cultures of interest. Interview colleagues who are members of that culture. And most of all, spend time living with it.